Hello dear students, my name is Askarova Miri Maksutkaze. I am assistant of the nursing department of Semey Medical University, and today we will discuss about topic catheterization of the bladder. During our lecture we discuss about what is purpose of catheterization, definitions, indications and contraindications, necessary equipment for doing this procedure, and especially we will touch about types of catheters, procedure depending on gender and age, and possible complications. Purpose of catheterization. Urinary catheterization is a common and necessary procedure for many. It has become widely popular in urogenital practice in the has both therapeutic and investigative effects. A catheter can be placed for a period of time for diagnostic purpose. Inserting a catheter may seem like a simple task, but no. Certain subtleties must be observed during the procedure. This will help avoid complications. If we don't keep all of the rules, all of the algorithms during this procedure or after this procedure, we can create some complications. So urinary catheterization is the insertion of a device to drain urine or deliver medications. The procedure is performed to diagnose or treat exciting urological disease. Depending on the indications, the catheter may be placed temporarily or permanently. Let's touch definitions of what is it, a catheter. A catheter is a medical instrument. It is like tube designed to connect natural channels, body cavities and vessels with the external environment for the purpose of emptying them, introducing liquids into them, rinsing or passing surgical instruments through them. Catheterization is the process of inserting a catheter. A urinary catheter is a system of rubber tubes or metal tubes that is inserted into the bladder through the urethra to control the amount of urine excreted or to diagnose its composition. There are two main types of urine bags, can be connected to a catheter and used together as a single system. The end of the urinary catheter must be properly connected to the urine bag to prevent urine leakage and to secure the bag to the stretcher if the patient is not ebulating, for example after operation period or unconscious patients, or to the patient's side, patients who have active mobilities, who can walking in department, in room, for example. We will connect urine bag in the patient's side if your patient ambulating. Indications and contraindication for this procedure also we have to know. We can do catheterization of bladder if we have next indications: edema of the urinary tract, interstitial cystitis, genital trauma, bladder of urethral cysts, urethral stenosis or spasms, acute urinary retention, temporary disability, tumors of the urinary tract, bladder outlet obstruction by stones, bladder diverticulum, several spinal injuries, or postoperative rehabilitations. When we have next contraindications, we don't have permissions to do procedure if urethral strictures, current urinary tract infections, reconstructive urethral or bladder surgery, and urethral trauma. Also, when we do catheterization procedure, we have to know types of bladder catheterization, because we can fix catheter special tube in short term or long term. We can fix our catheter long time or short time. And if the first case, if we use short term catheterization, it is catheter is inserted into the urinary tract for up to several days, while in the second type it is inserted for continuous urine drainage. Types of bladder catheterization. Ureteral catheterization involves inserting a stent catheter through the urethra. This is performed after antiseptic cleaning of the genitalia. A local anesthetic is injected into the urethra to relieve pain. The procedure is performed only if the urinary tract is normally patent. Ureteral catheterization involves inserting a catheter into the ureter. This procedure is performed when separate urine collecting from the left and right kidneys is necessary. Usually, ureteral catheterization we use when our need to diagnostic aims. It is recommended for stones and for administering medications into the upper urinary tract. Also, when we do catheterization procedure, we need to know how many types of catheters we have. What types? If we say about consist from the materials, we can have three types of catheter. It is rubber soft catheter, elastic semi-rigid catheter, and metal rigid catheter. If we say about rubber soft catheter, it is Nelaton catheter, Timan catheter, Foley catheter. If we say about elastic semi-rigid rigid catheter, it is only a doctor can insert an elastic catheter into men. Metal also similar. The placement of a metal catheter is performed only by a doctor. Also, we have two-way catheter, three-way catheter. If we say about catheter Foley, we say about two-way Foley catheter, inlet for balloon infiltration in the bladder cavity. We fixed our catheter in the bladder cavity, and second way, a channel for urine out flow. If we say about three-way Foley catheter, inlet for balloon infiltration in the bladder cavity, second way channel for urine outflow, and third channel for connecting the bladder irrigation system. When we say about Nelaton catheters, it is stretched with a blind and then oval opening on the side. Nelaton catheter we often use if you do catheterization a short time, only defecation period, for example. Timan catheters stretched with a blind end in the form of a curved beak and an oval hole on the side. We have Mallecord or Petzer head catheters with a large thickened head for retention in the bladder, designed for long-term drainage of urine through a suprapubic fistula. Also, when we say about catheters, we don't forget about catheters are available for men, women, and children. It means that we have three types of catheters for men, catheters for women, and catheters for children. It depends from the gender. A rubber catheter is a rubber tube 25-30 centimeters long and 0.33 to 10 millimeters in diameter. Women's metal catheters are shorter and less curved than men's catheters. It depends from the anatomical structure features. Metal catheters consist of a handle, a shaft, and beak. Men's catheters are 30 centimeters long, while women's catheters are 15 centimeters long, with a slightly curved beak. It is crucial to choose the correct catheter size before performing catheterization, because if you don't choose a correct size of catheter, it can be cause variously types of complications, and our need to size type of catheter before we will start catheterization procedure. When we do catheterization of bladder, also our need to know what kind of equipments, list of equipments for doing this procedure. First equipment, it is urinary catheter. Urinary catheter can be Foley, For example, if you do a long time catheterization or an elatone or another, it depends from the indications this procedure, it depends from the age of your patient, it depends from the gender of your patient, and also depends from the situation, yeah. And also next equipment, it is urine bag, sterile gloves, 0.9 proton sodium chloride solution if we use Foley catheter, sterile tweezers, sterile tray, forceps, disposable syringe, waterproof pad, bedpan, napkin, furantoin solution, petroleum jelly, antiseptic for mucous membranous. In our case, we can use chlorhexidine solution, antiseptic soap, and hand sanitizers. Class B medical waste container, and also our need to special documentation. In our case, it is inpatient medical records where we write that we do catheterization procedure. When we say about catheter sizes, if you see this slide, we can see variously types of catheter and end part of catheter. It is 2 ways of channel, 3 ways channel. If we say about Foley catheter, and Tiemann tip, whistle tip, and Cudet tip. When we say about size of catheters, we don't forget about we can use catheter in pediatric department, adult department. If we use if we do catheterization procedure in pediatric department, we can use from 6 to 10 Scherier's catheters. Scherier's, it is amount of diameter of our catheters. If we do catheterization procedure in adult department, if it is female, we use 12, 14 Scherrier diameters. If it is male, we use 16, 18 Scherrier diameters. And if we have clot retention, we use 20, 22 Scherrier's catheter. And catheter length can be, if you do for children, it is 30 centimeters. If we do female, 26. If we do male, it is 43 centimeters. And also we now that we have futures catheterization procedure, features of the depending on the patient's gender and age. Why? Yeah, our question. Because this procedure for urinary catheterization varies significantly depending on gender due to the anatomical differences in the urethra. If we say about male, urethra is longer and has 2 constrictions, making the procedure more complex and requiring a particularly delicate approach, while women have a shorter urethra, making catheter insertion easier. Age also influences the choice of catheter. In particular, children require thinner and shorter catheters. Also, before you doing your procedure, before you do catheterization procedure, we need to prepare all the equipments. And also during our procedure, we don't forget about features of the procedure depending on the gender. We have complications more if we do catheterization process for men, because men have anatomical features of urinary system, and we need more carefully when we insert catheter. If we see the next slide, we can see table compare for men and for women. Again, anatomy The urethra for men is longer, has bands and two physiological constrictions, which complicated the insertion of a catheter. If we say about anatomic for men, the urethra is shorter, making the procedure easier. Techniques. When we say about algorithms of doing catheterization, if we say about men, the catheter is carefully advanced through the urethra while pulling the penis onto the tube. The insertion depth can reach 17-23 centimeters. If we say about for women, the catheter is inserted to a shallower depth, usually up to 7 centimeters. And when we do catheterization for men, we can see more complications because the urethra is more sensitive to injury and infection, so the procedure requires special care. If we say for women, it is procedure more easier and we don't see more complications because we have less futures, less complications than men. And position of during this procedure, the woman lies on her back with her knees bent and legs spread apart. If your patient can do. If your patient unconscious, for example, we can't to give this position. If we say about futures depending on age, we said about size of catheters. If your patient children, for catheterization in children, special pediatric catheter sizes are used, typically 6 till 10 years. For adults, the choice of catheter size depends on the individual patient's needs. Women often use 14-16 years catheter, while men use 20-24 years catheters. Necessity: prescribing a specific catheter size should be done exclusively by a physician. When we do catheterization procedure, during or after this procedure, we can call some complications. What kind of complications? First complication, it is urinary tract infections. One of the most common problems, especially with long-term catheter use. Bacteria can enter the catheter and cause cystitis, it is bladder inflammation, and pyelonephritis, it is kidney inflammations. Next complications, urethral or bladder trauma can occur when a catheter is inserted incorrectly or carelessly. This can lead to bleeding or microtrauma, or also if you don't use lubricant, for example, it can be cause or create discomfort and irritation caused by the mechanical impact of the catheter, causing a burning sensation and stinging during urination. Next complication is urethral stricture, a narrowing of the urethra that can develop as a result of scarring after an injury, making urination difficult. Creation of false passages, the formation of false passages in the urethra, making future catheter insertion difficult. Parahemosis complications, also trapping of the glans penis by the foreskin if it is not repositioned after the procedure. And bladder perforation, a rupture of the bladder wall, which is extremely rare but can be. Also, catheterization of bladder, it is practical skills. Our need to do in mannequins, our need to practice. But when we prepare our patient, prepare ourselves for this procedure, our need to keep main moments, a main step. A general recommendation and preparation step, it is first, patient position. The patient should lie supine position with the knees bent unless this is impossible. this is position we have to give before this procedure. Yeah, we need to inform our patient about position. Next, it is antiseptic. Before the procedure, the area around the urethra should be cleaned with antiseptic solution, for example, furanceline solution. Before catheterization, I will need to clean urethra area, and after cleaning, we start to insert tube. Yeah. Also, a main step it is lubrication. To improve catheter glide, lubricate the catheter with sterile petroleum jelly or another special gel. For example, Vaseline, glycerin gas we have to use, because if we don't use lubricant and insert catheter without lubricant, it can be cause complications, a very strong complications. Next step, it is procedure. The catheter is carefully inserted in the urethra. We need to insert carefully, don't fast, don't so very hard. I will need to carefully until urine flows from the tube, indicating proper positioning. And next, it is post-procedure. If the catheter is inserted for a short time, it is removed after all urine has been drained. For long-term placement, the catheter is secured to a urine collection bag, and the free end of the tube should not be elevated above the level of the bladder. This is all of the 5 moments we have to keep, because when we do our algorithms, our steps right, our procedure in the end will be effectively. And the conclusion. We have some moments that we don't forget. First, if you do catheterization, and catheterization should not be performed if urinary retention is due to trauma to the lower urinary tract, the urethra, cervix, or sphincter of the bladder. We don't do. Catheterization is performed using soft, rubber or rigid metal catheters, and don't forget, if we use rigid catheters, this is procedure do only doctor. A soft catheter should always be used initially and only if a rigid catheter is unsuccessful. If after using a rubber catheter your procedure was non-effectively, yeah, productive, we can change a rubber catheter and use rigid catheter. The catheter should be inserted carefully without force to avoid injury to the mucous membrane of the urethra. In this regard, it is safer to use thicker catheters that effectively spread the walls of the urethra. If such a catheter does not enter the external opening of the urethra, a narrower catheter is used. This is conclusion. This is a rule we have to keep in our brain, because when we know definition of this procedure, when we know how we choose size catheters and type of catheters, when we know what type of catheterization you do, of course it depends from the indications, it depends from your patient's age, it depends from the situation, medical situation, and it depends from the what kind your patient have disease, yeah. But when you do all of the rule, catheterization process will be effectively and without some complications. Thank you very much.